Everyone likes to smile and show their teeth. And by eating the right foods and brushing twice a day, you can help keep your pearly whites in good shape. I'm going to meet a second grader who's keen to sink her teeth into a career as a dentist. Hi, Lucinda.
Hello.
So why is it you want to be a dentist?
Because it's really interesting helping people with their teeth and using a lot of equipment.
And why do you think it's important to brush your teeth regularly and eat the right foods?
Because then you won't have sore gums, and when you eat it, your gums won't hurt.
Have you got any teeth that you've kept?
No, they're all with the tooth fairy.
Do you want to come and meet a real dentist and go to a surgery and see heaps of cool stuff?
Yes, please.
All right.
Teeth are important for a number of reasons. We use them daily, we probably don't realise it, but things just such as simple as eating, and they're involved with speech and of course giving us a nice smile as well.
What are your favourite subjects at school?
Well, I really like maths, and I'm really good at science, and I've got 2 merit certificates.
There we go. Hi, James.
Hello.
Hello.
This is Lucinda.
Hi, Lucinda.
When did you decide that you wanted to be a dentist, and what's your favourite thing about the job?
I decided after I've been at uni for a few years, I wanted to go into a job where you can help people. And that's what I love about my job. I get to meet a lot of people and get to help them out if they've got problems and give them healthy smiles.
Why is it important to spot problems with people's teeth earlier on?
It's important because the earlier we can get to problems, sometimes it means less treatment is needed later on, and it also helps people avoid being in pain.
How do you find those problems?
We do exams of patients regularly, and we take things like x-rays, which can show us any problems in the teeth, and we can also check the health of the gums. Okay, Holly, if you can be our patient and jump in the chair.
Sure.
And then Lucinda, if you'd like to assist us, I've got a coat for you.
Primary school and high school in particular, I was sort of interested in science, so subjects like biology and chemistry in particular, they sort of were the ones that particularly got my interest in sort of the health and science areas, and then they were useful going on into uni. We recommend most patients come and see a dentist about every 6 months, and it allows us just to keep an eye on how things are going, everything's okay and the teeth are all healthy.
Okay, Lucinda, we're going to have a look to see whether there's any plaque on Holly's teeth now. I'll show you how to do that. So we'll just put the chair back. And then what you've got there is some special gel which shows us whether there's any plaque on the teeth. Okay, so we're going to put some of this on the teeth, painting it on, and then we'll give it a rinse, some on the bottom teeth. I'll sit you up, Holly, so you can have a rinse. Some good indicators that we might have healthy teeth would be that the gums are healthy, they're looking normal, and also signs that somebody's teeth might be unhealthy would be the gums might be red or puffy or bleeding. Holly, do you want to take that mirror? And Lucinda, do you want to have a look as well?
Oh, man.
So what we can see there, areas where the dye is a bit darker, and this shows us where there might be plaque sitting between the teeth. So we can see it tends to build up where the teeth meets the gums. So when we brush our teeth, we brush to try and remove as much plaque as we can, which is hard to see, so that's how this gel helps us see where the plaque is.
Can you show us the correct way to brush our teeth?
Sure, so the correct way to brush our teeth involves flossing as well. So to floss, we get a piece about this long, and wrap it between the fingers, like this, so you can press down. And then what we do is we just click it between the teeth, and then make sure we wipe all the way around and underneath the tooth, behind and in front, touching the gum, and then go to the next tooth all the way around behind and front where a toothbrush can't reach. And that helps get rid of any plaque that might be sitting between the teeth. And so then we can go on to the brushing. We want to brush 3 areas of the teeth, so if you can just open, starting at the back tooth and going around in small circles like that, going tooth by tooth all the way around until you're finished, and then on the outside against the cheeks here, one by one, all the way around. And then when we're finished, to finish off the top teeth, backwards and forwards like that on the biting surfaces. Foods that are best for our teeth are ones that are low in sugar and low in acid. So if we can try and keep down sugary foods, and also how often we have sugary foods is important as well.
Can you tell if someone's making good health choices just by looking at their teeth?
You can get some ideas if patients have been having diets that have got too much acid in them, things that are too acidic, like soft drinks, or if they've got diets that have too much sugar, sweets and lollies in them. So a good way of checking whether there might be anything wrong with the teeth is by taking x-rays. So we'll take a couple of x-rays of Holly's teeth now. So we'll use this one here, which is the film, and we'll just sit it next to the teeth. And if you can keep still, we'll line this up like that.
What can these x-rays tell us about Holly's teeth?
They can tell us a few things. These ones in particular will be able to tell us whether there's any tooth decay or any holes in the teeth. And you can come out with me, we'll press the button and take the x-ray.
Consequences of not looking after your teeth can result in gum disease, which can sometimes affect the bone that holds the teeth, and teeth can become wobbly or sometimes lost, so you can end up missing teeth, or if you're not looking after your teeth, other things that can happen is you can get holes in the teeth.
So are my teeth looking okay?
Yeah, your teeth are looking good.
Well, what are some of the common problems that people have with their teeth?
Sometimes we see decay in between the teeth. Sometimes we can just see decay coming in from the top. Other times people might have gum and bone disease, and some people have missing teeth as well.
What if someone's got a hole in their tooth?
Well, if we see that on the x-ray, what we can do is usually we can make the tooth numb and then go in there and then put a filling in that hole to fill it up and then make the tooth all nice and complete again.
There's a number of reasons why we take moulds of people's teeth. We can make things such as dentures or mouth guards from them, or if we need to have certain work made in a lab, that mould gets sent to the lab, which we can use to make crowns and bridges as well.
So what are some of the options that a patient has if they've lost teeth?
They have a few. If they've lost a few teeth, they can consider something like a denture, which sits in and out of the mouth just like that. Or also they can have a bridge, which is where the lab makes a few teeth joined together. So it depends on the exam and the assessment we do. Or sometimes if they're just missing one or a few teeth, you can do an implant, which is a screw that goes into the bone. The course at university involved a range of science subjects, lectures, tutorials, and treating patients under supervision, and sort of that worked up. They become more frequent as the years went on, and then in the end we were treating patients sort of regularly towards the end of the course, ready for graduation at the end as dentists.
I want to go to university because it's very interesting, all the equipment that you can use and helping people with their teeth.
It's so important to care for your teeth. And James has shown us just some of the interesting equipment available in the dental surgery. And I think Lucinda might just head off to university with a dental career in mind.